All right, so whether you're able to implement the 1x6 lower interiors, either by having the right mold or possibly reducing the mold in size, you should have the same scenario, okay? So just like we had on the maxillary interiors, if we ran a pencil here across the incisal edges, you can see how there's a gentle transition between all incisal edges all the way to the buccal ridges of the 4s and the 5s and so on. I mean, we can go all the way to the back, all the way to the 7s. So we have this gentle transition. We have a symmetrical looking arrangement. Okay, so the left side is a mirror image of the right and so forth. When we'll look at it from a frontal view, just elevate this a little bit to get a better view. So it appears that the incisal edges are pretty much on the same level as the remaining posteriors. Same level. Nothing really sticks above the plane of occlusion, so to speak. The buccal and lingual cusps of posterior teeth are on the same, are leveled, are parallel to the hinge axis of the articulator if mounted properly, and they're also level to the plane of occlusion. The long axis of lower teeth have this slight distal inclination to it. Even though I trimmed them, they still do. There's a labial inclination of the centrals, but there's no labial inclination of the laterals. And in fact, when we get to the canines on either side, there's a lingual inclination, meaning that the incisal edge appears to be further lingually than the cervical third of the tooth in order to complement the buccal slope of the posterior teeth on either side. So we have the buccal slope, lingual inclination, no lingual or labial inclination. So the laterals, when we look at them from a proximal view, they're pretty much straight up and down. And then the centrals have this slight labial inclination, so the incisal edge is outside the cervical third of the tooth, and so forth. And there's a gentle transition all the way to the other side of the buccal slope. Okay. When we bring the articulator together, we should observe a vertical overlap or an overbite. And we do, so we don't see spaces between upper and lower incisal edges. We should observe a horizontal overlap or an overjet. So meaning the upper incisal edges are labial to the lower incisal edges. So when I turn the articulator over, I'm just going to remove this incisal table. You should have an overlap, a horizontal overlap or overjet, just like we had buccal overjet. Now we have labial overjet. And the overjet should be evenly throughout between distal of the 1-3 all the way to the distal of the 2-3. Try to keep it equal. And furthermore, the last little bit, which is the most important part, we should have balanced occlusion. Meaning, just like we had balanced occlusion with our posterior teeth, towards one working and the other working, and as well as protrusively, we should maintain that contact with the posterior teeth, and at the same time now we should have contact with our anterior teeth as well. So when I move my articulator to simulate a right working, I still have it with my posterior teeth on the right side. I still have my balancing contacts on the left side, but also now I have incisal contact. I'm missing a bit of an incisal contact between 1-2 and 4-2. I can go back and tweak that. And now we check the other side. And again, I have left working and right balancing contacts, as well as incisal contact between centrals and laterals, a little bit better with the 2-2 against the lower 3-2 and 3-3. And finally, when I move the articulator straight out, I should have incisal contact just like that between the centrals, as well as posterior, just like we had before, on either side. So if I move it straight out, incisal contact, as well as posterior contact. And at the same time, nothing has changed on the maxillary, and everything looks symmetrical. We have a nice tight centric feel to the case. When you tap things together gently, you should have a distinctive loud sound between upper and lower occlusal surfaces, meaning you're getting a lot of contacts between upper and lower occlusal surfaces. And once again, this nice overjet and overbite, which was established as a result of the cuspal inclination, the compensating curve on either side, as well as the condylar inclination that we incorporated when we programmed our articulator.